broadcast is now starting. All attendees are in listen-only mode.
Good evening. How is everyone? Welcome. I'm Michelle Thompson. I'm the Director of Community and Recreation Services for the City of Green Acres. And it's a privilege and a pleasure that you've joined us this evening. We have a great topic on anxiety. I think it's very relevant with everything going on, for sure. And I want to just give you a little background about the Let's Talk series that the city has developed. It is a monthly community conversation on mental health, wellness, and personal safety topics presented by local professional subject matter experts. And again, we're honored to have Dr. Needle here with us tonight. The Let's Talk series actually was developed to support the city's mission to continually improve the quality of life for the residents, businesses, and our local community. And also the Community and Recreation Services Department's mission to promote diversity in community life, leisure, and recreation by enriching the lives of residents through programs, classes, athletic opportunities, and community events. The topics we've been addressing through this series that started in September, and tonight's series on anxiety, are difficult, complicated, and some of them very sensitive in nature. And many of us have been touched by the different topics or experienced them in one way or another. And so we believe it's the city's responsibility to discuss the topics, provide educational opportunities, and to encourage community involvement. It takes all of us to make our community a better place to live, learn, work, and play. And we're hopeful that our collective efforts will provide a healthier, stronger, more unified, and resilient community. It's my pleasure to introduce our guest speaker. And for those students that are in the audience tonight, if you're here attending for community service hours, I do want to let you know that we ask that you keep your camera on. You stay for the duration of the session. You also write your name, school, and grade in either the chat or the Q&A box, and we'll kind of take your attendance. And then you can either email or stop by the community center on 501 Swain Boulevard to get your community service form signed and verified. All righty. So it is my honor to introduce Dr. Rachel Needle. She has received her master's and her doctorate in clinical psychology from Nova Southeastern University. She received her bachelor's in psychology from Barnard College at Columbia University. She's a licensed psychologist and certified sex therapist in private practice and the founder and executive director of the Whole Health Psychological Center, a comprehensive psychological practice with a broad range of specialty areas and therapists. Dr. Needle is an adjunct professor of psychology in the Department of Behavioral Sciences, in the Masters of Forensic Psychology, and doctorate in criminal justice programs at Nova Southeastern University. She's also the founder and CEO of Advanced Medical Health Training Institute and the co-director of Modern Sex Therapy Institutes, which provides continuing education to mental health, medical professionals, and sex therapists all around the world. It's not even the start. The Institute provides certifications in sex therapy, couples and sex therapy, LGBTQIA affirmative therapy, alternative relationships, medical sexology, and transgender affirmative mental health care, sexual trauma, sex counselor certification, sexual trauma certification, sex educator certification, and also a PhD in clinical sexology. Dr. Needle is also the founder of Palm Beach University, a school offering graduate degrees in mental health. Dr. Needle is also been interviewed and quoted in national media outlets. She's been featured in popular magazines such as Glamour, Cosmopolitan, Men's Health, Details, and Shape, as well as also noted in the Washington Post and the Palm Beach Post. I've written several articles for Glamour magazine's online blog called Smitten. Dr. Needle's clinical and research interests include alcohol and substance abuse disorder, including the impact of substance abuse on relationships and family, sexual function and dysfunction, relationship concerns, sexual compulsivity, battered women, and trauma. Dr. Needle has presented her research and clinical work at national and international conferences. And wow, what a bio. So we are honored for your presence and your time tonight. Thank you so much for being here. We look forward to your discussion.
Thank you so much. That was a mouthful. It's making me anxious just hearing all that. Um, so I thought it would be good, given it's an anxiety presentation, we're going to start and end with a little anxiety reduction technique. So before I get started, I'd like you all to sit comfortably in your chairs, knees bent and your shoulders back, relax your neck a little bit. And I want you to breathe in slowly through your nose and out through your mouth. And while you're doing that, you can put your hand on your stomach and a hand on your chest, because we want to be breathing from our diaphragm. So we want to make sure that the chest stays as still as possible and the diaphragm expands upon inhale. So you want to breathe in slowly through your nose, let your diaphragm expand. If you need to kind of push it a little bit to make it happen, that's okay at the beginning. And as you exhale, it goes back in. You want to purse your lips as you exhale. So breathe in, hold it, and breathe out. And just take a couple more breaths. Breathe in through your nose to count of 5. Hold it, and out through your mouth. And in through your nose. And remember, as you breathe in, you want your diaphragm to expand, and out through your mouth. And just one more. So that is called diaphragmatic breathing and can be really helpful for you to practice doing a couple times a day. You can do it when you go to the bathroom in the morning. Doesn't have to be for a long time, but there is research that shows that over time, it'll help your baseline, your physiological response to stress and anxiety lower over time. So it's also helpful because if you get used to doing it, then eventually you can use it when you do feel yourself becoming anxious. You can kind of already be skilled at doing it so that you can use it as a tool. So anxiety disorders are the most common mental disorders in the United States. And I don't know why this is showing up like this. I did not mean to do this, but essentially this is what we're going to cover tonight. So anxiety disorders are one of the most common mental disorders in the United States. Over 40 million adults experience an anxiety disorder every year. There are many types of anxiety disorders. Only about 1/3 of the people that suffer with pure anxiety disorders receive treatment. And even for those who don't have a diagnosable anxiety disorder, many do suffer from some kind of anxiety. And I'm going to talk about the different types, either generalized or in specific situations. So of course, we know that over the past couple years, due to the pandemic, anxiety has gone up for everybody, right? That doesn't mean somebody has a diagnosable anxiety disorder, but a lot of people are experiencing increased anxiety, and some that didn't probably, meet the criteria now. And for those that did, it's most likely exacerbated because this has been a hard time. So this is a really important topic, I think. I think a lot of these topics right now have, given the pandemic, are exacerbated. And I think it's really great that this is being done to highlight some of these issues. So let's go over some of this. So we're going to start with what anxiety disorders are. So they're a group of disorders where anxiety is the major component. And they're, again, the most common group of diagnosed psychiatric disorders. So it's important to understand that there is a difference between normal and abnormal types of anxiety that people experience. And there's different types. So symptoms, diagnosis, treatment plans, and approach to anxiety will change depending on the person and their experience. So it's important to remember that. So I hate this, how this doesn't show up right away. I did not do that intentionally. So let's first look at normal anxiety, because normal anxiety is experienced by all of us at times. And it is, and that's not a negative thing, right? It is actually helpful for us to experience some anxiety. And I'll get into that. It's an expected part of life that for us to have occasional anxiety. But anxiety is a general feeling of nervousness, concern, or restlessness as a result of unrealistic threat or some sort of perceived danger. Again, most people will feel anxious when faced with a problem at work, for instance, before taking a test, before giving a talk like this, before making an important decision. That is normal, and it actually plays a function, right? It can help us. But anxiety disorders involve more than just this temporary worry or temporary fear. For a person with an actual diagnosable anxiety disorder, the anxiety doesn't go away and can get worse over time. So the symptoms, when you have a diagnosable anxiety disorder, the symptoms might interfere with daily activities such as job performance, schoolwork, relationships, and that's how we know that's really an issue. So again, anxiety is a normal reaction to stress and can be beneficial to us. It can alert us to dangers, for example, and help us to prepare to deal with those dangers and to pay attention. Anxiety refers to anticipation of a future concern and is also associated with muscle tension. So you'll notice sometimes when you get anxious, like I know I feel it in my shoulders and in my neck, and avoidance behaviors. Fear, on the other hand, is an emotional response to an immediate threat and is more associated with the fight or flight reaction. How many of you know what that is? I actually can't see you, so if you could just verbally say it. When I have a presentation up, it doesn't let me see anybody else. So to stay essentially, or to like escape, to leave to escape danger. So for some of us, anxiety will cause us to avoid situations. And that usually actually triggers or worsens our symptoms. So we think that it's helping us, right? Because we're avoiding dealing with something, but really it often makes it worse. So in general, for a person to be diagnosed with any kind of anxiety disorder, the fear and anxiety, again, must be out of proportion to the situation or age appropriate and hinder the ability to function normally. So how many of you have experienced some sort of anxiety in your life? If you could just say I.
Yes, I.
Okay. One person, how many are on here? One?
No, there's more.
What?
I think all their mics are off.
Well, then there must only be one person in here, because I would say every one of us has experienced some sort of anxiety in our lifetime. Again, it is normal and expected and adaptive, actually. So understanding the difference between excitement and anxiety can help one differentiate between types of feelings. So feelings of excitement are physiologically similar to the feelings of anxiety. So what we feel when we're excited, that's often what people feel when they're anxious too. So what kind of things happen to you when you're anxious? I don't know who said that they've experienced it, but for the one person in this room who's been anxious before, what have you experienced? How do you know you're anxious?
Oh, sorry, go ahead.
How do you know you're anxious? No one?
Somebody was talking. I think I cut him off. Sorry. Who is out there? Go ahead, please.
All right. Well, I'll tell you, for me, I know my heart rate increases, right? I can kind of feel it. For some people, they start to sweat. They experience other forms of emotional arousal, feelings of butterflies in their stomach, or for some, they just have a bad stomach ache. So we all experience different things, but those common symptoms are similar to when we are excited and when we are anxious. So the effects are different, as increased anxiety can actually lead to a possible decrease in performance, right? While increased anxiety can actually enhance performance because it helps us to, try more and to work harder. Doesn't mean it's good, but it is adaptable and can benefit performance. So we want to understand how to manage it, how to deal with it. So when we look at the different, the different types of symptoms, we can start to differentiate and understand the difference between different types of anxiety and arousal patterns in our body. So we want to make sure that we are paying attention to what is happening in our body when we're feeling anxious. So let's start with autonomic arousal. We can experience multiple symptoms that are included on the list below, right? Hypo or hypertension, chest pain or some sort of discomfort, palpitations or tachycardia, we feel our heart racing, hyperventilation or shortness of breath, dry mouth, sweating, dizziness, nausea. So these are common types of symptoms that one can involuntarily or unconsciously experience when they are anxious. Then we have some somatic symptoms. So these are another type of common symptom that we experience, as these relate to the physical bodily experiences. So someone might experience headaches, muscle tension, as I mentioned, feelings of fatigue, along with others when they have anxiety or increased anxiety, feelings of anxiety.
It says you're currently muted, but like that means they muted it.
All good? Yeah? Oh, okay.
Oh, can you hear me?
Finally, we have psychological symptoms, which are symptoms that occur from a mental standpoint, psychologically, and those can include stuff like restlessness, irritability, worrying thoughts, fearful anticipation, and can even start to affect our sleep. We may have trouble falling asleep, our concentration. When we have really high anxiety, we probably have difficulty concentrating because that's all we're thinking about. So it's important to note that all of these symptoms can happen. They're more likely to occur when we are feeling anxious. So what we use as a psychologist, I use the DSM-5, and that's short for the Diagnostic and Statistical Manual of Mental Disorders, and 5 just means that we're on our 5th edition. So here are the different types of anxiety disorders that are found in. There's 12 categories: separation anxiety disorder, selective mutism, specific phobia, social anxiety disorder, panic disorder, panic attack, agoraphobia, generalized anxiety disorder, substance medication-induced anxiety disorder, anxiety disorders that are sometimes due to another medical condition, and then we have the sort of unspecified types of categories. So also included here are obsessive compulsive disorder and post-traumatic stress disorder. So I'm sure some people might not have expected that PTSD would be categorized as anxiety, but a whole chunk of the characteristics that make up post-traumatic stress disorder have to do with anxiety symptoms and things like, avoiding places that we used to go. But I'm going to go into each one of these a little bit more. The most common one, anxiety disorder, is called generalized anxiety disorder, which we abbreviate as GAD. So the clinical features, to start, include stuff like excessive anxiety, but to diagnose this, it actually has to be for more days than not for at least 6 months. So let's say something happens, which is usually like, specific to something, or something in your life happens that, of course, you would have anxiety. God forbid somebody in your family gets hurt, or you have something coming up, again, like a talk, that you're experiencing some sort of anxiety. Again, it's not that you're going to have a diagnosable anxiety disorder. So generalized anxiety is like you have a general sense of anxiety most of the time. So that's what we need to diagnose this. So in diagnosis in this, you have to have difficulty controlling the anxiety, and there must be an association with 3 or more of the following. So you can see the 6 points there. So you either need to be restless, feeling up or on edge, be easily fatigued, have difficulty concentrating, or just your mind going blank, irritability, muscle tension, or sleep disturbance, which can be you having trouble falling asleep, having like a restless night's sleep, or just not being able to sleep. You have to have 3 of those to actually be diagnosed with generalized anxiety disorder. The other thing is that it has to impair your social, occupational, and daily functioning. So it interferes with your life, right? Like you can't function properly because you are having these symptoms. And it can't be attributed to a substance use or medical condition. So that's, if you can remember from the last slide, there are specific categories for that, but it is common for certain medications, certain medical conditions, and certain drugs or alcohol to mimic anxiety or to cause all of these symptoms. So we have to differentiate and make sure it's not those things that are happening. All right, so this is a fun one. Oh, sorry. So lifetime prevalence, we see that 45% So that's a really high number. More biological females report anxiety and are diagnosed than biological males. And for most, if you can see 50, 90%, so for most, there's also another mental health condition that can be diagnosed. Lots of times it is depression, now, which is our next talk for here, I think. So for most people, we see the onset in the early 20s. That does not mean it can't be earlier. There are plenty of children, adolescents that experience anxiety and that are diagnosable. That is happening more and more today. But that is what's coming. So, and we can't help it, right? So, you know, a lot of people go immediately to the medication. And I'm not saying that some can't be helpful, but really the best treatment for anxiety is typically therapy, and even mixed with the medication, although therapy can be really effective as well. So panic disorder, this is another large disorder that is worth breaking down a little bit, because there is a high prevalence rate for this as well. So the clinical features that we see with panic disorder include recurrent or unexpected panic attacks, with 4 of the major symptoms that are listed here. So if you see these clinical features, you have to have 4 of them. Some of them are similar, but you have palpitations or pounding heart or accelerated heart rate. For some, they feel the palpitations, but it's like almost inside. Like let's say if I would think I'm shaking and then I'm, you know, my heart beating faster. But if I put my oximeter on, or if someone touches me, like I'm not shaking. For some people, they will be, but for a lot of people, that's not necessarily able to be seen. Sweating, so lots of somatic symptoms, trembling or shaking for some, sensations or shortness of breath, chest pain or dysfunction. For some people, they feel like they're choking, feeling dizzy, uneasy, lightheaded, often because you're literally, you know, like your body is speeded up and experiencing those other sensations. So there's a lot of potential characteristics, but you only need to meet 4 of them to be diagnosed with a panic disorder. Excuse me 1 second, I'm trying to sip a drink. Okay, so usually we see that at least 1 panic attack experienced by a client that comes in must either be persistent concern or worry about having them again. So once somebody has had 1 panic attack, they are incredibly freaked out that they are going to then have more, because, you know, it's a scary feeling for some people. For a lot of people, they think that they're dying or having a heart attack when this happens, and that is very, very real. And a lot of people will go to the hospital, but some people who have panic disorder won't go to the hospital when certain things happen, when really they should. So that's something that's scary that happens too, is that once, you know, when you have anxiety like this and you just attribute something to anxiety, if you've had it for a while and you're like, hey, you've been through this drill, or people in your life think you've seen you go through this, they're less likely to pay attention to when something might actually be medically going on. So it's important that you take it seriously, but that you learn how to
Can you hear me?
and pick up on when you're starting to experience this. Do we need to mute someone? Yeah. Okay. All right. So we see this usually people have their first panic attack in their mid-20s. But again, that does not mean that people cannot have them earlier. That is just sort of the mean onset that we see. All right. So we see a mix of physical and psychological symptoms that go on. It lasts, you know, kind of peaks within minutes, but it can last for quite some time. So phobia or fears. With phobic disorder, it's important to first understand how phobia is described. A phobia is a fear to an object or to a situation. So it's diagnosed when there is when the fear is intense, when functioning is impaired, or if avoidance of a situation occurs. So if you start avoiding something, so and I'll talk about the different types, but there are specific phobias. So phobia to snakes, let's say, or to cockroaches. A lot of people have social phobias. So, fear and anxiety associated with social situations. and agoraphobia, which is an intense irrational fear in open places, in a crowd, or in places where there's perceived embarrassment or difficulty. Oh, I already said all that. So for a lot of people who are agoraphobic, they fear using public transportation, being in open spaces, being in enclosed spaces. So, you know, feeling like they're being closed in on, standing in line, or being in a crowd, or being outside of the home alone. I'm trying to remember the name of the actress. She's a famous actress. I can't remember her name right now, but she had a documentary kind of on, or an interview about how she used to wouldn't leave the house, and now she's a little older these days, but she's all over the screen. I can't remember her name. I'm gonna have to find that later. But anyway, also we see intense anxiety. Why am I having issues remembering people's names these days? Ricky, I think it was Ricky Williams, who's a Miami Dolphin. He used to, when he'd be interviewed, he used to have like a paper bag over his head. He had such anxiety. And he actually worked with a sports psychologist on it. So, you know, a lot of people experience anxiety. It is nothing to be ashamed of. It is nothing to, you know, hide. And it is something that absolutely we can help, or help people to manage, so that they can live and function in their life without being, you know, overtaken or ruled by their anxiety. But it's scary. Not super important, so I just included that for you. So social phobias differs from agoraphobia in that it's an intense irrational fear of scrutiny or social performance, or social or performance situations. So being around other people, fearing being embarrassed, just being anxious, having others being around you, that you'll be negatively evaluated. And so because of that, you avoid situations. So some people then resort to not leaving their house, but it's not because they're fearful of leaving the house. It's more that they fear that social pressure and negative evaluation, and it impacts them, right? Because when you have anxiety, social anxiety, you know, you often don't do the things that are important, and it can impact you in work situations as well. And for all of these, they really include that it can't be better accounted for by another mental disorder.
I'm sorry, I can only enter in listen only mode. I just want to let you know that I'm here.
I use that as an opportunity. Okay, so lifetime prevalence of social phobia is 10 to 14%, equal in male, female, and with therapy, it can be helped. So the final group is specific phobias. And these are intense irrational fears of specific objects or situations that are not better accounted for and explained by agoraphobia or social phobia. So, you know, it includes avoiding or tolerated with intense distress or anxiety in certain situations. People know that their fear is excessive. It's not like they're looking at themselves saying, you know, I'm okay. They know it's excessive, but they're still experiencing it. We see the lifetime prevalence between 10 and 25%, 6-month prevalence, 5 to 10%, and more common in biological females. So for most people, this starts in childhood. So obsessive compulsive disorder, which I'm sure most of you have heard of and referred to, of course, as OCD. It has clinical features that include the presence of either obsessions or compulsions, or both of those. When differentiating between obsessions and compulsions, there are a couple of descriptions of each, but that should be recognized and that are important. So obsessions are recurrent intrusive thoughts, ideas, or impulses, or action made to ignore or suppress these. And there's action made to ignore or suppress these thoughts. Compulsions are repetitive behaviors or mental acts or behaviors made to present or reduce the anxiety or stress. So repetitive behaviors, washing your hands all the time, right, to prevent something. Counting a certain number of times, or doing something to reduce anxiety. So we see a lifetime prevalence of these of 2 to 3%, and, you know, a little bit more in biological males, we often see that major depression occurs as a result or in addition to obsessive compulsive disorders, but again, it can be treated in therapy. PTSD, this one we see a lot of. Many clinical features in the DSM that help us with diagnosing it. It's known to have anxiety in response to a severe trauma that involves a threat to one's personal safety, injury, or death. It can result from witnessing the event or on someone else, persistent re-experiencing of the trauma, and hyperarousal or efforts to avoid the trauma. Now, I think it's really important to just mention that a lot of people, say PTSD when they're not referring to actual diagnosable PTSD. When we talk about trauma, even though this says that this is anxiety in response to severe trauma that includes threat to one's safety, trauma in general can be anything that we perceive as harmful or scary to us. I mean, it could be, I could have a trauma response or feel traumatized from something that somebody said to me in the lunch line when I was in 3rd grade, right? We are all different in how we react, how we interpret, how we respond to things. And that different things can be experienced as traumatic for each of us. So it's important that we remember that, because I think people both overuse it, but also underestimate how certain things can impact somebody. So back to PTSD, we see it after a traumatic and life-threatening event, and usually chronic. And it depends on what else is going on in terms of, because remember, like, these things don't necessarily happen as isolated events, right? Doesn't mean that the person went into something 100% psychologically healthy and then something, they experienced this life-threatening trauma. They're going to respond differently depending on what else was going on in their life, if they had any other diagnosable mental or psychiatric illnesses. So, it will all depend. But we can work on that in therapy. And there's different types of therapy and different factors that can contribute to how bad anxiety is or how it's treated. So we look at the etiology of anxiety disorders, and we find that there are biological factors. So that, I think I have a slide on each of these. Biological factors, so things, genetic factors, autonomic overactivity that already exists. So that's why some people might respond differently to trauma. Neurotransmitter dysfunction, so we see different neurotransmitters that are high or low or impacting people's anxiety and how they respond. Psychological factors, so we do see learning or behavioral contributing factors to somebody acting that way. So modeling an over-anxious adult, so you see your parent or caregiver respond in a certain way, and you kind of learn that you have that response to things when it comes up in your life. So oftentimes when we see a very anxious child, for instance, we may look at somebody in their life and they may also respond to things or be very anxious as well. According to cognitive theory, we may see overestimation of danger or harm in a given situation. So we overestimate the chance of that, or underestimation of the ability to cope with perceived stress. So thinking we can't deal with whatever comes up. Then we have psychological or pharmacotherapy. So there are medications that can be helpful. I'm not a huge fan of the benzos. Benzodiazepine will include things like Xanax, for different reasons. I mean, they can be very beneficial for people in the short term. I'm not a fan of long-term use. It is the one medication that really you can build tolerance to, and therefore could, potentially even die if you just stopped it without help and tapering off. It's also kind of like, I'm anxious, I take this, I feel better. And it's kind of like, okay, well, now I need this to feel better. I much prefer, if it works, something like a tricyclic antidepressant or an SSRI, because that is something you can take on a regular basis, and over time it works. So it's not just like you learn that in response, you can, I'm anxious, let me feel better right away. It helps you over time. But there are options, and that's something you have to sort of weigh the benefits, the risks, and decide for yourself or with your medical provider, which hopefully is a psychiatrist with training in this. We often see, I think, the most psychotropic medications. Psychotropic are medications we use to treat psychiatric disorders. are actually given by primary care physicians these days. I think it's really helpful to make sure that you want to make sure, it's oftentimes trial and error anyway. So you want to be doing that with somebody that's trained in this area if you can. I understand that access is sometimes an issue. So certainly, again, working with a mental health professional in some respect, even if it's psychotherapy, again, is very beneficial in these situations. So different types of psychotherapy. A lot of people talk these days about CBT. We'll start behavioral therapy itself will be things like systematic desensitization, which will be looking at the kind of like a hierarchy of things that cause you anxiety and working on techniques such as the one I briefly gave you a demonstration of at the beginning to reduce the anxiety for everything sort of leading up to the highest amount of anxiety, preventing certain responses, stopping your thoughts when you're starting to have anxiety, because oftentimes thoughts can lead to us experiencing those feelings of anxiety. So we want to stop the thoughts that keep coming up, and relaxation techniques, of which I'm going to give you another one at the end. CBT, so cognitive behavioral therapy, one of the most commonly used or known about these days. So it combines cognitive therapy and behavioral therapy. So all the things I mentioned with behavioral therapy, but then also addressing your thoughts, the cognitions. So correcting maladaptive cognitive thoughts. So irrational fears or other things. So we often have these automatic thoughts that come up, and we're usually learned or we've had them usually since we were pretty young. They come up, we want to challenge them, we want to work on them so that we are not, so we're able to not just act on them and be impacted by them. We want to be able to look at them, be rational about them, replace them with other thoughts that are more realistic. Psychodynamic therapy is developing insight into interpersonal conflicts and personality deficits that will impact the symptom formation. And honestly, I think that we need CBT and techniques in the here and now, to lesser and lower the anxiety. But for most people, there is also some underlying stuff that I think that the psychodynamic work is important. What we are seeing as more reimbursable is by insurance companies and more pushed is the CBT, is because it helps. I mean, it 100% helps and it's measurable, but a lot of times we then see, if there were these underlying issues, we see it come up in other ways. Okay, so I went over a little bit about the diaphragmatic breathing. I want to do another one that is called progressive muscle relaxation. And in doing so, we focus on, I'm going to stop sharing my screen. Okay, hi. Well, first, before I do that, let me see if there's any questions. I'd love to have people, I think, Michelle, you're the only one that chimed in before, but maybe some other people would ask some questions or talk about your own experience, ask me questions about that. I want to give you an opportunity before I try to do the progressive muscle relaxation. I can't call you out because I can't see the attendees. No? I can't hear you, Michelle. I can't hear anything.
Get shouted at.
Michelle, you should be able to speak now because you're unmuted.
Am I? Can you hear me?
Yes.
Hello? Can you hear me?
Yes.
Okay, we've been trying to actually access this from 6:30, and we are only able to enter in listen only mode. So I'm glad that you can hear me now.
Oh, good.
Yeah, it doesn't allow us to show the video. My daughter is here, Chastity Ricketts. She's attending the meeting. She's also here listening to you guys. And in order to obtain service hours, I just wanted to make a note of that as well.
Wait, I can't really hear. Can someone, Michelle, will you repeat that for me?
Yeah, she was saying that her daughter is here for community service hours. We've got you noted, Cassidy. You're good.
Thank you.
Anybody else before I talk a little bit about progressive muscle relaxation? Nope. All right. Do you guys want to do progressive muscle relaxation? I think it's going to be very helpful. I won't go through the entire script, but I want to give you a little taste of what that looks like. Is that okay? All right. So you want to find a quiet place where you can relax, turn off your phones, dim your lights, but you can sit, you can lay down, whatever is best for you. You just want to make sure that you are comfortable and able to enjoy it. So you don't have to close your eyes right now. I just want to give you a sense. I want you to become aware of your breathing. So do some of that diaphragmatic breathing like I talked about first. You can calm your body a little bit. So take some deep breath through your nose, out through your mouth. As you breathe in, you breathe in some of that tension. And as you breathe out, you want that tension. As you do this, you want to notice that your body is changing. As notice those changes. So just take a couple more deep breaths. Okay. So now let yourself sort of return to normal. And we want to bring your awareness. What we're gonna do in progressive muscle relaxation, just like it sounds, we're gonna go through each body part and we're gonna tense it and we're gonna relax it. And as you tense it, you wanna notice what it feels like as you're tensing up. And then as you release it, you wanna notice the difference. Okay, so let's bring our awareness. Let's start by bringing our awareness to our feet and our toes. So I want you to breathe deeply in through your nose. And as you do, gradually curl your toes down and tense the muscles on the soles of your feet. So tense, tense, tense. Hold your breath for a minute. And then release your muscles as you breathe out. So I want you to feel as you exhale that muscle tension go away. So I want you to do it again as you breathe in, tense and curl your toes, tense your feet. And as you breathe out, let go of that. And one more time, and I want you to notice the difference. Tense, hold it, and then release. Just notice the difference between tensing and releasing. So now bring your awareness to your lower legs, to your calf muscles. So as you draw in a deep breath, I want you to point your toes towards your knees and tighten these calf muscles. So hold it. And as you breathe out, I want you to relax. So we're going to breathe in again. You're going to curl your toes up so you can tense your calf muscles. And as you breathe out, I want you to let them relax. And one more time. And out. So next we're going to do the front of our thighs. So if you're lying down, you can try this by straightening your legs. But if you're sitting up, you can just sort of pull your legs out and just, tense up that muscle. So, or put your heels down to the floor to tense it up. So as you breathe in, you want to tense. And as you breathe out, release. Breathe in and tense. And out and release. And one more time, and I want you to enjoy that relaxation of the looseness that you feel after you release. Next, we're going to go to our butt. So as you breathe in, I want you to tighten your butt. Hold the contraction for a few seconds, and then release as you exhale. Again, in through your nose, tighten your buttocks. And exhale and release. And notice the difference between tensing up and releasing. And one more time. And release. Okay. Now I want you to bring your awareness to your stomach. So as you take a nice deep breath, you're going to tighten your stomach. Hold it in and tighten it. Imagine that you're trying to touch your belly button to your spine. So take a deep breath in. And out. and in, and out, and in, tighten, and out, and relax. So now bring your attention to the muscles in your back. And as you slowly breathe in, you want to kind of slightly tighten your back muscles by tensing up and sitting up. In, out, and in, and out. And breathe in and out. And I just want to mention that when you're doing this on your own, you're going to do it a little bit more slowly. I'm very conscious of how people feel when they're in this public forum of doing these things. I just want to give you the idea. And if anyone's interested, I'm happy to send you a list of like a sheet, like a cheat sheet, if you don't remember kind of what to do. So now bring your attention to your shoulders. So I want you to tension your shoulders. Bring them to your ears. Into your nose and bring your shoulders up and out through your mouth. And one more time. And out through your mouth. So feel the heaviness being released as you do that. You're at a calm, more peaceful place as you do that. So now in your arms and your hands, we're going to start with our upper arms. So raise your wrist towards your shoulders and tighten the muscles of your upper arms. And do it again. And relax. And one more time. And now we're going to bring our awareness to our forearms. So you want to kind of curl your hands inwards so that your forearms are tensed. Breathe in. Feel how tight that feels when you do that. And as you breathe out, notice how different that is and how they feel relaxed. And again, and relax. Okay. Now you're going to clench your fists. So it's our hands, time for our hands. As you breathe in, clench that. And let go and feel your fingers kind of release. And again. And one more time. Now we're going to move to our face. We're going to use our muscles in our face. We're going to squeeze our eyes shut, clench your lips together. So breathe in and out. And in. And one more. Breathe in deeply while you scrunch the muscles in your eyes and your lips. And feel how much better that feels when you release. Now our jaw. Take a deep breath and then open your mouth as wide as you can so you can feel your jaws stretching. And exhale and close your mouth slowly. And again. Getting tired, that's the goal here, right? You're gonna relax. So fill your lungs with air and open your mouth wide. And then exhale and let your mouth release. So now take a moment to check in with your body from toe to head, head to toe. Feel relaxed. Take some more deep breaths and kind of just listen to your breathing. And that warm sense of physical relaxation. And feel free to click off and go sleep now. I tell you, I would have been demonstrating this in person had we been in person. I told Michelle, this is going to be great because I'm going to show them how you talk yourself out of and get yourself out of a panic attack firsthand when I thought that we were going to be in person. I hardly leave my house. I have everything here. I was nervous and then I got myself ready. I did some anxiety reduction until, of course, this Omicron, Deltacron, all this stuff. And then it was, I couldn't do it. So thank you. I know this is not easy on the computer, but I do hope that was helpful. And I did want to leave some time for questions and comments. And I encourage you to continue to do diaphragmatic breathing every day, to do the progressive muscle relaxation. You can always contact me. I had my information on that first slide. I can bring it back if you'd like, but also Michelle, you're welcome to give people my contact information. Let me see if I can bring it back just so people can write it down. There you go. So, oh, I know what I don't have on there? My email. How can I forget my email? I'm gonna see if I can add it right now for you. Can you see me adding it? Do you see that?
Yes.
Okay, good. So drrachelneedle@gmail.com. Feel free to reach out to me if you need anything at all. And I really encourage, if any of you are struggling with anxiety or know somebody that is, please feel free to reach out. If I can give you referrals or someone at my office, we have anything between, we take a lot of insurances, we slide our fee based on need and income. I will not turn anybody away. I will make sure you get help regardless. So please do reach out. You do not want to continue to struggle with this. You want to try to work on it so that you can live a healthy and a normal life, and so that it doesn't continue to impact you, because if you don't, it's probably going to get worse over time.
I have a question about what's the best way to support somebody with anxiety. If you don't know what they're going through, it's really hard to understand it.
So now you do understand some of it, hopefully, right? I think the most important thing is to take it seriously and to be empathic. Never say, calm down, it's okay, you're being dramatic, you're being crazy. Like, that's their experience of it, and that is very real for them. And anxiety is very real. So we all experience things differently. So the most important thing is to be empathic, compassionate, be there with them, share some of these tools with them, and certainly share, say, I support you. I met this, cool doctor, and I can introduce you. And if if you're interested in talking about it, if not, I'm here for you until you are, and just take it seriously. Because I think a lot of times that doesn't happen.
Yeah, I think sometimes people minimize it, minimize it way too much.
Yeah.
So it's too late sometimes as well.
Yeah.
We have any questions, anybody out there? I think we got you unmuted. You would just have to unmute yourself to ask them, or you can put them in the chat.
I have a question.
Go ahead.
How do you deal with, or if there's such thing as social anxiety, being, trying to avoid crowds, or being, nervous in a social setting and that type of stuff?
Yeah, that's a great question. I think in similar ways, like practice some of these anxiety reduction techniques and do small things, right? Like give yourself an out. So go somewhere and say, I'm going to go for 15 minutes, and practice some of this in there and slowly insert yourself into social situations which you feel comfortable in. It's a little bit harder right now, obviously. But do some of these techniques. Pay attention to the thoughts that you're having. Is that informing? Is that causing you to be anxious? Are there, irrational thoughts, or are they rational? Try to challenge, any of the rational ones a little bit. And if you're having trouble doing this, there are some, like I said, really good cognitive behavioral techniques. You may not have to be in therapy forever. You could go 1 or 2 sessions and it could be helpful, but try to practice some of these things and slowly start to insert yourself into situations which you have an escape in, right? You don't have to stay. Stand in the back, hang out. If you're feeling anxious, try some relaxation techniques, try challenging those thoughts. And if you're still feeling anxious, go home.
Thank you.
What other questions do we have out there?
Hi, Dr. Needle. It's Susie.
Hi.
Hi. I asked it in the chat, but I guess I'll go ahead and ask it here. For parents, sometimes we do see that they're exhibiting the signs of anxiety that our child is, or maybe we're interpreting it as that, and maybe it's not. So do you have any suggestions for a parent on how to best approach a child that we might perceive as experiencing anxiety or some other issues without without obviously being a parent and diagnosing them or escalating the matter as some of us might tend to do.
Sure. And so I would start by normalizing it and educating them about it, just about anxiety in general. So you know what anxiety is. A lot of people experience anxiety. There are times where I experience anxiety. Here are the situations that I do. You can use television shows where one of the characters, and you can ask, what do you think they're going through right now? And kind of talk it through with them that way, to introduce it that way and let them know, like, everyone experiences anxiety sometimes. If you ever experience it, I'm here to talk to you about it. And if you don't want to talk to me about it, you want to talk to somebody else, there are people that their job is to talk to people about their anxiety and to help them with it. And I would also practice just on a regular basis. I get into both modeling, like showing your children, like when you're anxious or when something goes wrong, how you deal with it. By practicing mindfulness, practicing anxiety reduction techniques, not kind of, flying off the handle, etc. And so modeling that, and then also when you notice that they are handling something in maybe a maladaptive way, introduce something. Say, can we, will you try breathing with me? Or, let's, what's going on for you right now? Let them calm themselves down. When you're calm, we can talk then. Don't react to them. That's the worst thing someone can do, is like react to their child, especially depending on the age, like, which we often do, because let's be honest, especially if it's in public, it can be embarrassing. So you want to end it as soon as possible. But what the best thing to do is to let them learn to self-soothe, and then go back and talk to them about what was going on and help introduce some other tools that they could do besides laying on the floor and freaking out or getting anxious. Or so those are some ideas.
Thank you.
We have 3 other questions in the chat. We have one: where can I get my hands on information for anxiety for a teenager? Sorry.
I'm sorry, anxiety for
a teenager?
So very similar. Obviously teenagers are dealing with a whole lot more right now, and just in general in the generation now, at school, including bullying and a lot of more social pressure, etc. So I would make sure that they have an outlet, someone to talk about. If you notice them doing that, again, same thing, introduce some of these concepts, model some of these things to them, and then encourage them to talk to somebody. And if not, they're still under 18, you can bring them to a professional. If you notice that they're really struggling, like you don't want to let it just play out. Want to take it serious.
Another question is, what resources are there for people who want to go to therapy, but their insurance doesn't cover it?
That's a great question. And don't get me started on my soapbox of how insane that is and how private insurance companies drive me crazy. Call my office. I won't, if we can't find somebody, we will not turn you away. We have options for lower cost sliding fee scale for licensed people. We also have interns that work under my supervision. I do not want inability to pay to ever be a hindrance for somebody to seek out and get the services they need. So, and if for whatever reason you call my office and they are not as helpful as I've trained them to be, you say, I want Dr. Needle to call me, and I will call you. But I know they'll be thankful, so.
Somebody wants to know if they get a copy of your presentation.
The PowerPoint, absolutely. I can send it to you, Michelle, if you want.
Mm-hmm. Okay.
And so they can contact you, or you can, or either way, I can do that, or you can email me and say, send me a copy, and I'll send you a copy. What's easier, Michelle? Do you want to just send it to everybody that registered?
Yeah.
Maybe that's easier. Okay. So I'll send it to Michelle.
Yeah, I don't know if it's something that Jean can put in there under handouts while we're in the session right now. I'm not sure if we have that capability or not, but I think you'd have to send it to Jean, right, Jean? Let me see here. I have somebody asking if I received the previous questions. I did find one of them. Does the threat of hurricanes create PTSD in people temporarily or permanently?
Wait, I'm sorry, does what?
The threat of hurricanes create PTSD in people And is it temporary or could it be permanent?
Well, so when you say the threat of, so did somebody actually experience the hurricane at some point and now they're scared of future hurricanes?
If they're still residing in South Florida, possibly. Let me see.
Yeah,
Checking
so,
in my
so
phone.
yes, I mean, listen, anxiety doesn't have to be post-traumatic stress, right? You can have significant anxiety. Post-traumatic stress would be more if you had been in a situation where there was one, but it depends on the symptoms that you're experiencing. So absolutely, there's always situations in which people can have post-traumatic stress, but remember, it has to be after a trauma.
Okay. Here's another question. What are the signs senior citizens have anxiety due to memory?
What?
What are the signs senior citizens have anxiety due to memory? Is it due to memory loss?
I'm sorry, one more time.
Or maybe what is memory loss and the signs of anxiety?
Is memory loss? It can be, right? Because it distracts you from other stuff. So it can be a symptom for sure.
Okay, it says, yes, so memory loss can cause anxiety, I believe.
It
True or
can,
false?
yeah, it can. Anxiety can absolutely just lead because you're not paying attention as much. Your mind is in other places. You're stressed out, you know?
Yep. Let me see here. All right, so for parents, how is the best approach? Sorry, this font is very small and my eyes are really old and tired. Loris, can you read the chat by any chance? Can you see any of that? No.
Questions for some reason. I
Pardon?
don't, that's why I can't see the attendees. I can't see the chat.
Yeah, we have a lot of questions. I'm just having a problem reading them. All right, so I get that one. How do you deal with an adult sibling that has a narcissist, that is a narcissist and causes a lot of anxiety? Wow, that's a good question.
I mean, yeah, that's a whole presentation in itself. You know, I think it's really, family therapy might be helpful, but certainly making sure that you know, whatever personality symptoms are coming up are impacting them in the least amount possible, and setting boundaries and rules, and teaching the anxious person how to manage the person with the narcissistic tendencies. That's a very hard one.
Yeah, sometimes you just got to turn people off, I guess, right? Let me see. I have answered all of them or asked all of them.
Anyone else?
I am going through all of them right now. Well, I think somebody answered your question about Barbara Streisand. Didn't you have a question about somebody that wouldn't leave the house? Was it Barbara Streisand? An actress who wouldn't leave the house. Do you offer a psychology first aid class for non-professionals?
Do I offer a mental health first aid class? I don't.
Okay.
That doesn't mean I can't. I just haven't yet.
Let me see. Okay, I think we answered that question. All right, I think we went through all of them. If I am wrong.
Now, I sent you my presentation, Michelle, so you can, you know, feel free to share it.
Okay. I did get another question about what are some hobbies to reduce anxiety?
So anything, I mean, doing physical, doing some of these breathing and relaxation techniques and doing physical stuff can be really helpful for your body and to help decrease in anxiety. So go out for a run, play tennis, do something physical.
Okay. You have any other questions, anybody? So Dr. Needle is going to be joining us back for a depression talk, and that's going to be in March. Next month, we're talking about bullying, and that is on February 16th, and then depression for March 16th. Then we have April, the autism spectrum, and then we have suicide prevention on May 18th. June 8th, we've got developmental disabilities. In July, on the 13th, Dr. Needle will be back about eating disorders and discuss that. And then she'll be back on August 17th to discuss the opioid epidemic awareness. So we've got some really heavy topics coming on. And then we have gender-based violence scheduled on September 14th. So we'll keep advertising all of those for sure.
Thank you for having me. Thank you, everybody, for the great questions and for listening. I look forward to seeing you again.
Yes, thank you. Take care. We really appreciate it.
Thank you.
Good night, everyone.